Heard at Health is sponsored video content brought to you by Med City News.
Hi, I'm here with Brad from HealthSnap. Thank you so much for joining.
Thank you, Marissa. Thank you so much for having me.
Yeah, of course. So we're just going to jump right in. To start, RPM seems to be one of the fastest growing markets in digital health right now. What do you think is driving that, and how is HealthSnap addressing the core challenges faced by hospitals and health systems?
Yeah, it's interesting. I believe that health systems nowadays really know that a lot happens in between the visits, and they want their patients to stay connected with their care team. What RPM does, it allows them to stay connected with their patients, whether it's through a connected blood pressure cuff, glucometer, or even a weight scale. It provides the care team the insights so they can identify issues before they become problems. The challenge is that how do you operationalize all that? HealthSnap takes the heavy lift off health systems, so we help them identify patients that qualify for these programs. We handle all the device logistics, sending the devices to the patients, calling them, making sure that they're engaging with that device as clinically instructed. And then we hire nurses, we hire LPNs and RNs to help facilitate on the clinical side of the business.
Yeah.
That's what allows our health systems to grow quickly and sustain these programs over an extended period of time.
Yeah, that's great. And going off of that, HealthSnap recently announced two major health system partnerships with Sentara Health and University Hospitals. What specifically are these major health systems looking to do in their partnerships with HealthSnap?
Yeah, I'd be remiss if I didn't give a shout out to Sentara project team and the University Hospitals project team. They did great work. We're enrolling in, and we started to implement over 400 providers with Sentara. We've identified up to 85,000 patients that qualify for these programs. On or before the end of the year, we'll be in 100 practices with university hospitals, and mainly what these health systems are looking for is operational excellence. They want to know other organizations that have scaled these programs successfully. They look for EHR integration, their source of truth. They look for clinical outcomes, how the patients are improving that are participating in these programs. They look for a reduction of care, reduction in readmissions, and also reduction in ED visits.
Yeah, that's great. So to close things off, what are some new areas that HealthSnap is looking to get into moving forward?
Yeah, first and foremost, we're going to want to honor our current partnerships. We're going to execute against those on a daily, monthly, and annually basis. And we're going to do what we say we're going to do. But we're going to continue to work with policymakers, industry leaders to make sure that they're aware of the positive effects RPM is having on their patient panels. Moving into 2026, we're going to find like-minded organizations that want to provide a concierge level of care to the patients in which we both will be serving.